the Performance Institute. We were developed for all UFC rostered athletes. Now, keep in mind, we have 720 athletes on our roster that we care for. We also care for about 50 developmental athletes. But the Performance Institute was built because at the time, there was no conservative management, no performance based decisions being had for this athlete population. An athlete would fight. They would get an MRI. The MRI said a labrum tear. They would get surgical repair. They would be out 6 to 8 months and then they would return. So we were developed to bridge that gap between athlete and performance. Athletes, like actual injuries, vary from type to type. Every day, I could literally be walking in and an athlete could have a ligament tear and then transition right to a shoulder sublux or relocate, a finger dislocated. So my day is very, I would say, interesting when it comes to injuries. But the biggest thing I would say with this is the trust that we've had to gain with our athlete population. The information and technology we now have today can get these athletes back quicker. So we get less athletes pulling out due to injuries. We have athletes coming back faster from injuries, not taking that much time off in between fights. Athletes can have a ligament tear 3 weeks out, and with SoftWave, we can still have them compete in 3 weeks. The only time with this population that we will pull out of a fight is going to be if literally there's a brain issue or there's a heart or something like that. All other injuries, we've found ways to find conservative management and workarounds. But what's really cool about this population is we have about over 500 of our athletes baseline assessments. So we know exactly what they look like going in and what we need to get them to. So first we look at the impairments and address the immediate impairments. So if let's say it's a ligament injury, we're going to be doing a lot of manual treatment to stimulate blood flow. We're going to partner that with either orthobiologics, lots of manual based treatments. We're pairing it with SoftWave, a ton of ShockWave we use. It's our number one modality here. My last year of the Olympic team is when ShockWave started getting out there, and it was we used it for our track athletes. A lot of them with like plantar fasciitis or Achilles tendonitis. And we would ship our athletes up about an hour away in Boulder where a guy had ShockWave. And the ShockWave was used pretty aggressively. The athletes would come back. They got great results, but it would be a few days before they could get back to training. And when I came over to the UFC, it started becoming a more talk of the town. It started becoming a modality that was getting more and more popular. The research, the evidence was getting better on it. And then once I learned about SoftWave, that just has been a game changer for us completely. And I'm talking athletes that have post-surgical. I use it right away to get that pain and that inflammation out. Athletes with our grade 1 and grade 2 ligament tears, we're using it 5 days a week on them. Athletes are not even having to take time off. I just had an NBA player that came in and for the first time used SoftWave. They've used other radial like shockwaves, and they were like, oh, this is going to kill. I'm not going to be able to play basketball tonight. I'll miss practice. And both of them were like, I felt great and was able to immediately return to my sport in that evening. So I think it's been a game changer. I am not a modality person. Most of the modalities in my clinic literally have dust on them. The only one I will literally vouch for right now is SoftWave.
What was the main shift that you saw in switching from radial to a focal shockwave SoftWave? Almost specifically, outcomes, recovery speed, or things being not recovering before when you switch to a more SoftWave? Because I think PTs, and a lot of PT clinics have radial.
They
A lot
do.
of
It's
chiropractic offices have
affordable.
radial. Yeah,
It's
but
affordable.
I always say this from an economic standpoint, okay? We're always afraid to spend on something unless there's a true ROI, and we can't be convinced buying something more expensive has a better ROI. So from a performance level, tell me like
Yep.
what's been the game changers?
So number one, the athletes tolerate it way better. So the radial head is pretty aggressive. And remember, the radial head only penetrates about 4 centimeters below the skin, where the soft wave can go 4 to 12 centimeters. So I'm in an athlete population. So I'm getting that deeper penetration of the sound wave, which then lose a better outcome in that sense. Because a lot of times I think the athlete would have a superficial reaction of the pain felt better, maybe that superficial inflammation looked better. But to genuinely get down to where I need to, where that ligament is, get through that soft tissue, I definitely have found that SoftWave has been a game changer in that. I've seen that the ligament repair, like healing time. So if I have anything from a grade 2 or below, that athlete is back within 2 weeks to sport, which is insane.
So can you talk about like daily, like what's typically the number of shocks that you're giving, maybe frequency, energy levels? Are there certain conditions where walk us through a little bit of that protocol?
Yeah, so we challenge the normal protocols when it comes to SoftWave. We do it 5 days a week. I do it a little less intense. So to a patient tolerance where they feel it, but they're literally not going to jump off the table and scream. I find the 5 days consecutively doesn't do as much tissue damage immediately to that area. So the athlete tolerates it better and then actually can train. Because if I were to do soft wave at the highest level, bringing it up to 12, and then doing the highest energy I possibly can on that, it's pretty spicy. It's spicy on a ligament, on a tendon, on a muscle. If I just bring it down to about 9 or 10 on the intensity level and I do it 5 days a week, I literally can not have that athlete miss practice, which in this population, me saying they have to miss a day or them feeling like they have to miss a day because of the treatment modality I chose would not work at all. I go down a little bit in moderation when it comes to how high we turn it up, but we do 5 days consecutively if needed.
And is that a pre and post practice or pre, like, how does that work?
So that's a great question. So if it is a athlete that I'm trying to get, let's just say a ligament repair, or like structurally, I want to see regeneration, I want to see good blood flow, I'm going to do that after practice. If it's someone that has a little bit of fusion, inflammation, pain, I'm going to do it pre-practice so that they can perform better during that practice. I always say for our athlete population, quality is better than quantity. So I would rather them not having it like a joint effusion and go in and train half-ass, if I'm honest. I'd rather have them be able to do so. I'll pull those guys. I also will do it pre my therapeutic exercise for my rehabilitations because I can definitely see they'll come in and the joint will be a little bit more swollen, little pain. Immediately after I use the soft wave, I'll do manual treatment, I'll do soft wave, then I go into therapeutic exercise. We only do about 2,000 to 3,000 pulses once or twice to get these effects that we're already having.
Yeah, that's super. And those will also be low dose, right? The
Low
pre,
dose.
like, yeah,
Yep.
low dose. So when you say low dose and not a lot of pain, like I know typically the setting is like, hey, we want to get them to 4 to 5 pain. And sometimes at 4 to 5, people are like, oh, I feel it. But you're saying maybe even be a little bit below that where you're like, they're like, I feel it there, but they're just no issues, no grimacing, things like that. Is that what you
Yeah,
find most?
so I would say if I am trying to get more of the collagen repair, that kind of stuff, I'll keep them at that 4 to 5. Also, keep in mind our population has an insane high pain
Yeah,
tolerance.
yeah.
So I would say most of them, though, even by the treatments, are maybe a 1 to 2. But you look at today, I just saw the UNLV kid, and he was like, he got, I think, stem cells by Dr. or BMAC by Dr. Sampson like last week, and I partnered SoftWave with him, and he was like, Heather, I had it pretty high up in a setting. I had it up to 11 from, and I cranked it. And he was like, this is such a comfortable treatment, which was the feedback I got also from the NBA players. We had 2 NBA players from Summer League literally make their organizations pay to come here and use this device rather than the radial head they had brought on the road because they were able to play that evening. So I think
Yeah,
that's
yeah.
huge testimonial.
I always look at radial is, I mean, I know it does more to stimulate tissue healing, but it really is a great way to do excellent manual therapy without destroying your thumbs.
Yes,
So above and below, like the area of injury, I love using a radial, but and I think it's important that you impart this on people's, like, really the game changer is a true shockwave unit like SoftWave, where you can actually do some really rapid healing response and get some results quicker. It's
we
really
do.
not much of a difference in cost when you look at per treatment. And if you're doing multiple treatments, especially if you're in a high-end athletic population. And it's great to hear this because I think helps practitioners and physicians to change potentially the way they approach recovery. People want to get back faster. Like
They do.
time is money, okay? And even when you're a person who's physically active, like time is money and resource to you as well. You want that time back and back on. Super helpful to get that idea that you can treat every day. Like the results hold is what I'm hearing from you.
Yeah, and we constantly are testing that objectively. Like we're very much an evidence-based facility. Our whole goal is to change the evolution of MMA and keep a better, healthier population because what these guys were doing before, I would say, compared to what they're doing now from a recovery standpoint is night and day different. And they're realizing that this great technology that we're introducing to them definitely gets them back, allows them to train at their optimal level, keeps them in the octagon. So, they do get paid and keeps them healthier.
So that's a great segue. And when you've been introduced to the different biologics like PRP,
Yep.
bone marrow, I don't know if some athletes are getting adipose, but how active or aggressive are you in recommending that be a part of their treatment protocols? And what differences have you seen in the impact of alone and then obviously in combo? I think we know. And if for those of you that are new here, there's a previous webinar looking at Dr. Sampson's data with PRP and SoftWave, particularly SoftWave, and there was some incredible results of like faster recovery and better pain relief and return to function. When are you guys recommending it now? Is it more like a frontline or early therapy, or are you still waiting for things to persist and not heal?
No, honestly, I think we are using orthobiologics immediately in sports. I think it's honestly become a frontline component. So even if we suspect from our special test and our orthopedic evaluation a labrum, I'm even partnering that immediately with some type of orthobiologics. Their injuries, I would say, are more aggressive than most sporting organizations. So we tend to lean on a lot of orthobiologics. I tend to be more reactive, I would say, with a PRP than with the BMAC and the other stem cells, because I would say for the PRP in this case, if I have an athlete that is a grade 1 or 2, and I'm realizing, hey, we're getting to that 2 week mark and I'm not seeing that fast pace, they're going to do the PRP to re-stimulate that healing process. So I really focus on PRP when an athlete has done possibly even some kind of orthobiologic, they've done rehab and they're not getting it, we'll shoot them over to PRP to see if we can get that final
Yeah,
stage of
I
healing
think
to do.
I think this is such an important part that I want to impart to the community. So, if you had to talk about where someone would start, so they're going to integrate Shockwave into their practice, where are the key sort of high impact athlete conditions that you're like, home runs, start right away, don't waste your time?
Yep. Any ligament injuries, I am 0 day of injury, I start with Shockwave. Any ligament, any tendonitis, any inflammation of any tendons, I'm jumping on Shockwave. Small grade 1 muscle tears, or strains, I'm jumping on Shockwave. I would say any of that. And honestly, recently, which I think is pretty cool that we've just with having SoftWave, we can also do it with our lumbar spine. So I just had a lumbar spine facet, no radicular symptoms that I used it on, and they literally jumped off the table and were like, this feels so good. And I did some manual therapy, partnered with the SoftWave, and then I did some re-education and stuff and some core activation, and they were like, oh my God, I couldn't even walk before and now I'm doing great. So I would say I'm definitely, my hands down three biggest things is muscles, tendon, and ligaments. I am jumping on that boat day one. And then I'm now with the SoftWave and the depth being able to penetrate further.
Are there NFL people coming to the Performance Institute as well? And what have your experience been with them?
Yeah, so I actually just finished an NFL guy. I'm very lucky. I do some private clientele and have some very high end clientele on the side of the UFC job. So literally, I just had the Philadelphia Eagles send me a guy that got hurt in preseason and was like, "You have 3 weeks to get him back. I had a guy from the Baltimore Ravens that gave me 3 days to get him back. And I will say I actually incorporated SoftWave in both of their treatments. They were both adductor groin strains. One of them had adductor longus, brevis, and pectineus grade 2. The other one was a grade 1 adductor longus and inflammation around the pubis symphysis. And honestly, I partnered SoftWave with some dry needling techniques and then alignment and mechanics, and both of them worked really well. It's funny because I did one of the Raiders rehabs, one of the linemen I just finished, because his surgeon recommended doing rehab with me over at the PI, and I used SoftWave with him for out. And literally every day he's like, Raiders, can you please buy this machine? Like, my shoulder was crappy, and as soon as Heather started using this and doing my rehab, like, I have grown
Yeah,
leaps
I
and
don't
bounds.
understand why teams refuse to buy this equipment if they realize the return to play is so much faster, that when they're not playing and the money that's being lost, like it boggles my mind sometimes. It's such a traditional path that they're so focused on, and here you're turning people around quicker. And I want to bring up something that's really important. Those groin injuries are very difficult to treat. They're very difficult to rehab, as is hamstrings. And that is a big one, I know, in the NFL and certain other professional sports.
Because one of them mentioned to me with the Eagles that he had symptoms starting 2 weeks before the injury really occurred. He was noticing his groin was bothering him. And I said, "What did you guys do?" And he's, "Oh, they threw ice on me." I was like, ice is not going to fix a leg length discrepancy, an ankle with decreased mobility, hip lacking internal external rotation, alignment of the pelvis off. So with that, I was able to do like full evaluation. I did manual based therapy, I did needling, I did soft wave, fix the ankle mobility, fix the internal external. Actually, the Eagles guy is leaving because he's doing so good. And he started with 20 degrees of external rotation. There's no way in heck an elite athlete, 20 degrees of rotation can be cutting routes. And then with an ankle that has 20 degrees of motion, like it just doesn't happen. You have to address that whole chain. And I also think having an open mind allows you to look at athletes a little differently.
And would you say that you could use a type of soft wave type device, maybe in combo with radial, and treat the kinetic chain like all the way and see some of the muscles release and loosen, something that might be done with manual or that can get done quicker using the modality?
So the biggest modality, the reason I used SoftWave on both of those also were their chronic ankle stuff. They had a lot of scar tissue. They also had some bone. One of them has a bone spur. And when I saw him, so he's actually a really cool case if we have time to speak about. He was an athlete that was played for the Eagles, won a Super Bowl, was signed for 1 year with the Raiders, had 1 year to turn it around, somehow got on my table, realized the amount of ankle stuff. The Eagles had just been injecting that ankle for him to play, but the ankle got so chronic that literally every time he cut, he had to stand up, which was then making him behind the time for the passes. And he was kept missing because his pass timing was off. And I'm like, of course it is, because every time you cut, you can't go over top of that ankle. I literally took the whole season using SoftWave, ankle mobility, and like stability, proprioception, balance, and stuff. And the guy had 1,000-yard season, was picked up then for 3 years with the Patriots, now has done 2 years with the Baltimore Ravens. Here's someone that literally they were thinking was washed up, couldn't catch passes. And it was literally structurally because we didn't look at what his past medical history was, what his range of motion, strength, and everything, all the way up the kinetic chain. So I use SoftWave on both of these guys to help loosen up their ankle mobility. I also, when something's really chronic, if I've already needled the day before, then next day I'm using SoftWave on it to continue that really good elasticity of the muscle tone. So you can use it on all aspects, even if it's just a tight muscle that's really not letting go. Our injuries are a little bit different than most. And I think this just hones in on what we stressed today, that the body is very adaptable, and definitely using the SoftWave machine has treated most of these injuries for me.